love you like that. Taking care of yourself is the love no one else could ever give. Exercise and eating healthy, that's the best thing for your body. Smoking and drinking will not help. Sniffing and drugs, you'll hurt yourself. You gotta remember to check your blood pressure. You gotta take good care of yourself. Who's gonna love you like that? Taking care of yourself is the love no one else could ever give. Exercise and eating healthy, that's the best thing for your body.
Good evening, my viewing audience. In with this week's edition of Health Matters, I am your host, Shavani Nisbet, health educator at the Health Promotion Unit. This year, World Hypertension Day was celebrated on Tuesday, May 17th. To commemorate this day, we decided to have workplace screenings, which included the regular blood pressure checks, blood sugar checks, and the BMI calculations. As opposed to doing it in the public setting, we decided to take it to the businesses where the workers would be too busy to come to our public health screenings. So we did businesses such as Customs at Long Point, Nevlec, Water Department, and the Social Security Board. Here's a look at what we did.
And you know, even though you say you could have it without fear, you still have to be moderate in whatever you do. Because anything that is good for you, too much is bad. Okay, so even though water is good for you, if you drink too much water, it could be bad for some persons as well, depending on how much, and of course it depends on your body weight. Alright? Now, we are concentrating on hypertension today. When you think about salt, think about high blood pressure. No. Sugar makes food taste good. Salt also makes food taste good. Let's just say doctor recommended or prescribed a teaspoon of salt per day. Now we are used to, because of your taste buds and because of how you train, how we train our taste buds, we can't use just a small amount of salt because we're not going to taste it. No, there are times when, and that this is from a baby, yeah? Our taste buds are trained, are developed rather from babies, from when we are babies. No, you might do a bottle for a baby, let's say some cereal. And of course the cereal, everything that, especially the convenience food, they have salt in it, they add extra salt to it. Now, you would have added some sugar and maybe a little touch of salt because you believe in a little salt. And you say, well, this is for the baby, and the baby would have, used the sugar and the salt. And now, as the baby gets older, maybe the doctor says, maybe he has a particular condition, and the doctor says, no, you have to cut down on the amount of sugar, or you have to cut down on the amount of salt. And so you start reducing the amount of sugar or salt that you put in the baby's food. Do you think the baby is going to bring whatever feed that you would have given that baby after you reduce the sugar or the salt? You think it's going to drink it or eat it willingly? No, the taste buds are now used to a certain amount of salt or sugar. And once you cut back, like you're not going to want that food, And so you start developing that taste, the taste for salt and sugar in the baby from early. Really and truly, we don't have to put sugar in the baby's food, Do you agree? We don't have to, and we don't have to put salt in its food either. Do you think after you would have been using half a teaspoon and you have to reduce it to a quarter, do you think you're going to be able to taste the food really tasting nice and flavored? It's fresh. It's fresh. Now, do you think it's going to do anything to your taste buds to continue to use the quarter teaspoon daily? Do you think it's going to affect your taste buds? It will adjust. It will adjust. Now, when we are born, our taste buds, as I said before, it's real, they're real sensitive. Now, we would have made them insensitive by using a whole lot of salt. And after, you would have had to reduce it to the amount the first, let's say, week or so, you're going to say, well, this don't taste good at all. This is not salty enough. This is not flavored enough. But after a week or two, you're going to actually taste the salt again, because what you're doing now, what you would have done now, you would have trained the taste buds to be more sensitive.
My name is Nadine Cathy Keynes from the Health Promotion Unit, and today is World Hypertensive Day, which is an international health day that is observed worldwide. The reason for Hypertensive Day is to bring awareness about the prevalence of hypertension worldwide, and it's not here in St. Kitts Nevis, it is here. Hypertension is one of the leading causes of hospitalization and death in the Federation. And for this week, we'll be doing a series of health screening at different workplaces that we selected. And today we're at Social Security. We're doing a health screening here with the staff at Social Security. We started with a general educational session about salt intake and how we can reduce our salt intake and physical activity so that we can get our blood pressure into normal range. And for those of us who have blood pressure in normal range, how we can maintain it. Today we have community health nursing with us. They're the ones who will be doing the screening. And we have Mrs. Blackett, our dietitian, who did the educational session about what we eat, how we eat, and the amount of salt, and how we have, trained our palates in the overconsumption of salt and how we can retrain our palate. It becomes more sensitive. And then we have our counseling session, which is done by Nurse Eldina Farrell, who will talk to any of the employees here about ways they can manage their overall health. The health of our people determines the wealth of our nation. So therefore, we have to make sure that our people are healthy. And so we need to advise them, we need to educate them, and we need to motivate them to take stock of their own health. It starts with you. And so therefore, you have to monitor what you eat, how you exercise, monitor your stress, and seek advice. We at the Health Promotion are there. Community health nursing is there, or you can speak to your private physician about where you can manage your health. So we encourage persons to be aware. Today is World Hypertensive Day, and we encourage all persons to say no to salt. The theme for World Hypertensive Day for the past few years have been Know Your Numbers. That is, know your high blood pressure number. For community health nursing, we have Elvina Mulcair from the Gingerland Health Center, and we have Miss Jean Tyson from the Brownhill Health Center. And we have Mrs. Blackett, she's the dietitian, she's stationed at the Alexandra Hospital. And then we have Miss Chevany Nisbet, our health educator, Miss Shayna Howell, our surveillance officer, and Nurse Eldina Farrell, our health education and prevention officer at the Health Promotion Unit, here with us today.
So usually we would have our health screenings like this in a public setting where individuals can come and get all their vitals checked. However, there are some workplaces where the individuals are not able to come and get these done because of their work schedule. So what we are doing is we are catering to business places of that sort, like for instance, Nevis or the water department, social security, people who are normally busy during the hours that we will be out doing the public health screenings. And so we are encouraging business places who would like this done. You can always contact us, the Health Promotion Unit, at 469-8010 or 469-5521, extension 2064. And we would be happy to come and visit your workplace and be able to do screenings like this for individuals who cannot get to do it on a public setting. So as part of the activity, we have a pledge card that we ask everyone to come and pledge after they have done their vitals. So the pledge card reads, healthy eating and active living. Pledge card. I promise to do my best each day, to eat smart and exercise in every way. And the person puts their name and the date, and they're supposed to start their pledge to eat healthy and to be active every day. The back of it have some health tips, about 7 health tips, including eat a variety of foods daily, eat breakfast daily, exercise at least 30 minutes every day, and other health tips that are good for healthy living. So each participant gets one of these. This event is actually a good turnout. Most of the individuals in the office, they're positive about the activity, and they are participating. They were very good listeners to what Mrs. Blackett had to say, and they're all going to get their vitals checked, and those who need counseling will be going to get counsel. So it's a good event, and I'm glad that we are doing this so people can have an idea of what it is to eat healthy and be active. And thank you for watching this week's edition of Health Matters. I encourage you to continue to eat healthy, be active, and drink lots of water so we can lower non-communicable diseases such as hypertension, diabetes, and cancer. I'm your host, Chevany Nisbet, health educator at the Health Promotion Unit. The fruit of the week is mango. Mango is in abundance here on Nevis, and it has a good source of vitamin C and fiber. So have some mangoes every day this week, but don't overdo it.
Who's gonna love you like that? Taking care of yourself is the love no one else could ever give. Exercise and eating healthy, that's the best thing for your body. Smoking and drinking will not help. Sniffing and drugs, you'll hurt yourself. You gotta remember to check your blood pressure. You gotta take good care of yourself. Who's gonna love you like that? Taking care of yourself is the love no one else could ever give. Exercise and eating healthy, that's the best thing for your body.